Hello, my name is Jen Sandu, and I'm the Internship and Training Manager here at HomeFirst. This is a training on defining homelessness as part of the New Hire Training Week. I want to remind everyone to note emergency exits and follow along with announcements as needed. And of course, facilitator, please pause the training as needed to facilitate discussions and leading points. Okay, we'll get started as part of, again, New Hire Training Week. Welcome on board. We'll talk a little bit more about defining homelessness in Santa Clara County and for us as a community. So first, I want to talk to you guys a little bit about kind of where this all came from, which was a study called Home Not Found. It was conducted in between 2006 and 2012 by Destination Home and underwritten by the County of Santa Clara. And the County of Santa Clara really wanted to find out, quote unquote, whose problem is homelessness. At that time, we did not have a lot of resources, a lot of services. Again, HomeFirst, we've been around for 37 years, so there were services in the area, but not any coordination of services, coordination of funding, and things like that in Santa Clara County. So in order to improve the quality of services and really assess our community's need, the Home Not Found study was conducted. And again, it was also to find out, all counties and everything is about funding and financial information. So it was also to find out, quote unquote, whose problem is it? Who should be spending money to end homelessness in Santa Clara County? And I'm going to ask you guys in the room today to answer me this question. How were individuals that were homeless coming across and receiving county services? Or what types of county services were they running into? Again, you can pause me if more time is needed, but I'll give you the answer here. Individuals who were homeless were running across two systems mainly, and one, of course, was our health and hospital system through the emergency services, through ER services. The next is through the judicial system, through our jail services system. And again, that's because individuals that were homeless were receiving rapid and traumatic medical, mental health services that needed to be addressed right away. And these systems found out that they were, again, not ending someone's homelessness, right? They were only treating a symptom to the issue. Their systems are not set up to facilitate that long-term change, to facilitate a change for someone to transition into housing and to build stability. It is just to treat a very specific reaction or a symptom or a subset that someone is experiencing, either a mental health, a medical condition, or let's say they broke the law, then the treatment of that, and then that's it, was not meant to be a long-term solution. So again, we wanted to find out, how prevalent was homelessness in Santa Clara County, and again, who should deal with this, frankly. So in that 2006 2007, it took a whole year to just cut the red tape and understand all the HIPAA regularities and confidentiality releases that had to be put down to make sure, cut all the red tape really, to have all the different systems talk to each other. There was a lot of releases that we needed to obtain, a lot of systems had to learn to communicate with each other that normally didn't, so that we can track someone's homelessness or track someone's plight through the different systems of care, through methods like address, what address are you currently receiving, in order to, again, improve the quality of services and really designate and design services around the experience of homelessness. And in that 6-year period, we found that in the Santa Clara County, 104,206 individuals were homeless in that 6-year period. That is the population of a small metropolitan city here in the Bay Area. That's almost a little smaller than the size of Santa Clara. And it's a large amount of people. It's still shocking to me in this day. And what we found out that 20% of the individuals that were homeless at that time were homeless for just 1 month or shorter. And 32% of them were homeless for about 2 to 6 months, which means about 52%, over half of the population, homelessness was not a long-term way life for them. And this was challenging stigmas and beliefs within the county system. Again, we in homelessness know better, know more, But this was the long-held belief that someone who was homeless either chose to be homeless or were homeless for a very long time. In fact, that was not the case and is not the case, that homelessness is brief and episodic for most individuals out there, but the individuals who are seeking resources and services, we've got to figure out what's going on and how to really address their needs. The other 48%. Right? And out of that 104,206 individuals, we found that money question, right? That more than $3 billion of resources, services were being provided to homeless individuals. And again, $3 billion, I don't know what that looks like. You'll see me talking about this research in other trainings as well. I don't know how much money, how that looks like, what that amount looks like physically. Is it a room full? I'm not really sure, but it equates to about $520 million of worth of services in a year. And again, services for the healthcare system, the judicial system, that do not go to end homelessness, but just treat the symptoms, just the very top layer of what someone's condition is at the time. $1.9 billion of services went through healthcare services, and $786 million of judicial systems involvement were used at that time. And one of the statistics that still shocks me to this day is the top 5% of population. About 2,800 individuals used 47% of that total $3 billion, which means on average, someone that we would consider chronically homeless or persistently homeless has an average cost of about $83,000 in services per year. And remember, this study was done between 2007 and 2012. That's over 10 years ago this study started, right? The published results came a little later in 2015, but at that time, when individuals were experiencing this homelessness, $83,000 worth of services could have been a down payment on a home here in the Silicon Valley at that time. It could still be a down payment on a home for someone. Again, these services were not being used correctly to really end someone's homelessness, but to treat that symptom, right? So the funding wasn't going anywhere. And then in 2012, at that time, in 2011, 12, we decided as a county that, yes, this is an issue. This is an issue for our county. This is an issue that requires more than just addressing the symptomology through these different two healthcare systems. And then, of course, our Office of Supportive Housing was formed. We have the coordinated entry system and all the methodologies like the VI SPDATs and methods of engagement, outreach programs that really highlight and support the work that we do in ending homelessness in Santa Clara County. And this is part of a national effort as well. The study really has become a piece for a national movement for counties to study themselves and study where is someone receiving homeless services and is it going to really end their homelessness. So that was at one point. This was a study that was done a very long time ago. What are we doing in the meantime? How do we have a hand on who is homeless now in our community? And we do that in two different ways. One is through our point in time count, which occurs every 2 years in each community across the entire country. It usually happens in the coldest of times when we can really take a measure and really see homelessness. And it happens very early in the morning in most communities. So in Santa Clara County, the study usually happens in mid to late January. The results are printed in a national study in the Annual Homeless Assessment Report, the AHAR report for short. And again, this happens every 2 years. So this 2019 is the next year. This is a year that's coming up. In January, we'll be conducting a point in time count where individuals, volunteers across the entire county are partnered with formerly homeless guides and we're given a partial map, a part of a map of Santa Clara County where you would drive around and just by sight identify individuals that are homeless. And this is not a full training on the point in time count. I'm sure you have a lot of questions about that. Again, feel free to pause me and ask the facilitator about the point in time count and they can enlighten you. Again, you can also view if this is 2019 and point in time count has just happened, there should be a lot of research out there, a lot of literature around the positionality of the point in time count and how is it that those results are collected. There's two parts of the point-in-time count. The first part, of course, is the verification, the visual confirmation. And the second part is where the outreach teams go and make contact with individuals. And the formerly homeless individuals are also asked to do further surveys and conduct surveys with homeless individuals in the county as well. All of this information is tallied, and the methodology of calculating out an algorithm to really accumulate for the population is utilized as a county for us to really know the number of homeless individuals in Santa Clara County at a given time. And I will say the second part of that is a shelter count. And the shelter count is done every year. The statistics are gathered through the Help Management Information System, or the Homeless Management Information System, or HMIS for short. You'll learn a little bit more about HMIS as well. But these findings are also added to the annual Homeless Assessment Report, the AHA report. The most recent one was published in 2017, in December of 2017. And this report is part of a national finding. So this is what our community conducts on a regular basis, and then it's added to national findings so that we can really take a look at the picture of homelessness in the entire country. And statistics show that on a single given night in 2019, about 553,742 people were experiencing homelessness in the United States. That's 553,742. That, in other words, to take a look at it, out of every 10,000 people in our country, 17 people were experiencing homelessness. And 2/3 of those 17 people were staying in emergency shelters or transitional programs, and 1/3 were in unsheltered locations, meaning places not meant for human habitation. And we'll talk a little bit more about what unsheltered locations are and what not meant for human habitation is. Homelessness increased for the first time in 7 years between 2016 and 2007 by a little less than 1%, but this increase reflected a 9% increase in the number of people experiencing homelessness in unsheltered location. And there was a decline in the number of people experiencing homelessness in sheltered locations. So this was kind of offset, but there are 50 large cities accounted for around the entire country, and we take a look at the percentages of individuals that were homeless as far as sheltered or unsheltered, and the annual homeless assessment report really breaks down the results of both. It breaks down the results and gives us terms on someone who is considered chronically homeless, someone who's considered homeless, and this unduplicated one-time estimate that we do on a one night across the entire country. Usually it is, like I mentioned, in January, that last week, and we take a look at how that reflects the homeless population in Santa Clara County for the entire country, and these results are then matched up in other ways, and we'll talk a little bit more about that in creating systems of learning in our county, and how our system works together in our county to really end homelessness. But in defining homelessness, this is how we measure homelessness in our community. So I want you to think about what are some barriers to housing for our participants or shelter guests in Santa Clara County. Moderator, facilitator, please feel free to pause me while you guys have this discussion. Okay, well, I hope you've just had a lively discussion, and some of the things that you guys have talked about are some of the things that I hopefully will mention. And some of the things that individuals identify are barriers to their housing might be things like housing prices, that the market value in Santa Clara is much higher than any other area in the entire, as part of the entire country. There might be a few areas in this country where things are a lot higher, where homes market value, rental markets are a little tighter. That might be things like New York. But Santa Clara County, we definitely surpass San Francisco County for affordable market value and low-income market value availability. And that can really become a barrier to someone who is wanting to be housed in Santa Clara County, for housing in Santa Clara County. Some of the other things that individuals mention as barriers would be credit checks. That almost all landlords, private and corporate, are doing background checks in which your criminal history, your legal history, your financial records are scoured to see if you are someone that they are worth, that they can rent to. And there's some landlord bias in that, of course. But of course, there's that large gap as well. Also, the differences between a living wage and minimum wage, right, in our county is a little bit closer, but on by par, it is hard to afford an apartment on minimum wage on just one job in Santa Clara County. Something else, of course, might be is if you've had a lot of run-ins with the law. This kind of goes hand in hand with the background check, but on your criminal check, that could come up as someone who you may not be a participant, someone who a landlord would want to rent to because of an extensive history that didn't get verified, or your credit number, right? So these could be some barriers to housing for individuals who are here in Santa Clara County. And can you think of some contributing factors to one's homelessness in Santa Clara County? Some things that would account for or add to someone's homelessness in Santa Clara County. Again, facilitator, please feel free to pause me so that you can have this discussion. Okay, so hopefully you did pause me, and hopefully you did have a lively discussion. Some of those factors, of course, are the same, right? So as the barriers, but also some things that could contribute to keeping one homeless would be issues like a mental health issue. Someone who has untreated mental health issue, who doesn't have the support of a team, a case manager, a social worker to really work with them and to practice how to meet with a landlord, and access to resources on shower and practicing good hygiene and the ability to get there on time through a bus token or a ride. That level of assistance, that would be a contributing factor to keeping one in homelessness and not assisting in ending their homelessness. Another factor could be substance use. In the same way that it could be on a spectrum of high risk, where someone is really using and their use is getting in their own way of ending their homelessness. Or it could be that financial trouble. Again, we talked about the finances of living wage versus minimum wage, and all of that adding up. And what is it like once you have your budget for the month and you're spending resources and money on what you need to in order to just survive and maintain. Sometimes you don't have the income or the amount to put out to do $25 of an application fee on top of everything. Also, landlords these days are asking for double the income, right? So they're asking that, double the rent. So if your rent is $1,500, they ask that you make a minimum of $3,000, and you have to prove that on a month-to-month basis. And for someone who's on minimum wage, or someone who's receiving SSA, SSI, SSDI benefits, how can that be, right? Another contributing factor or a barrier might be that a lot of landlords in our county have stopped taking vouchers. They've stopped taking Section 8 vouchers or the other types of vouchers, individually specific need vouchers that are out there, so that you are working with a very smaller market of affordable housing in the first place. That small market of affordable housing is getting smaller and smaller. So that's also something that we have to be very cognizant too. So someone's story of why they're entering into homelessness or why they're receiving services from us today could be very different. And it's our job to create an open and honest dialogue for them to really talk to them about their needs, and how is it that we can help them in addressing their homelessness, in ending their homelessness, and building that long-term stability. So I want you to think about your role as part of the team, your specific role, be it case manager, be it resident advocate, be it employment specialist, housing specialist. I want you to think about your role and how is it that you take part in ending someone's homelessness. How does the dialogue, the conversation that you have, the documentation that you do, the work that you contribute to as part of your team, how does that go in that long-term mission that we have of ending homelessness and working with individuals to define in defining their place and really ending their homelessness. Again, facilitator, feel free to give me a pause here and have this discussion. If you've already had the discussion, we'll continue on. And and that really is a choice. I really want this to be a conscious process that we're engaged in at all times as part of our learning of what is our role. How is it that we contribute? If you're someone who interacts directly with shelter guests or program participants, then what is your role? How is it that we can really work together to change some of those barriers and work with someone's unique strengths and capabilities and resiliency to help end their homelessness? All right. So now we're getting into defining homelessness. And this is the most recent ruling put out at the end of December 2015 through HUD, the Department of Housing and Urban Development. And this is defined by Congress as someone who's homeless is defined to mean an individual who either lives in a place not meant for human habitation, a safe haven, or in an emergency shelter or an institutional care facility, if they've been in that facility for less than 90 days and they were in a place not meant for human habitation, a safe haven, or an emergency shelter before entering that institutional care facility. So if someone was living on the streets for one night, they are considered homeless. If someone stays in an emergency shelter for one night, they are considered homeless. At this time, HomeFirst, we have a policy of if you haven't stayed at our shelter in the last year, you can stay the first night, no questions asked, meaning we're not going to enter you into the system. And this is to help define sort of document your homelessness and sort of begin that process so that you can be in the process of receiving some services, some resources, and gain program entry into a program that's best applicable for you. So where does it come across? I'm going to ask you the question in the room. If someone is couch surfing, if someone is staying on someone's couch, does that count as homelessness? And hopefully your answer is a resounding no, and if you didn't know, now you know that if someone is couch surfing, they are not considered homeless because they have a roof over their head. They have resources. They might be limited, they might be time sensitive, but at this time they are considered housed as part of that household. What if someone is staying in a garage? Now that's a little trickier. That depends. If someone is staying in someone's garage and the garage is retrofitted, there's a point of egress, there's installation and batting in the walls, there's access to a bathroom, the room is temperature controlled, there's a heater or a cooler, then that would be considered not homeless. But if this garage was just a fitted garage where the outside temperature is reflected inside, you have to kind of go through the entire house or a bedroom to use a bathroom, or you don't have access to a bathroom, then it would count as homelessness. That depends on the outreach worker, on the person certifying their homelessness and verifying these issues. And if you are ever in that position, I would encourage you to take pictures of that garage to prove how you qualified someone as homeless, right? So in defining homelessness, we have to really think about that quote there, place not meant for human habitation. Individuals, human beings, we are not meant to live under a bridge or outside. We are not meant to live in a park. We are not meant to live in a tent at the on-ramp, at the cross-section of an on-ramp to a freeway or in between on-ramps. So think about all the work that our outreach team does and how is it that we can provide this verification, and define homelessness for someone, and think about kind of what those places are. And again, pause me if needed to generate a list of places not meant for human habitation. So we've listed some already. Also, a safe haven. A safe haven refers to either a safe domestic violence shelter for women and children whose location we cannot usually know. And usually we would document someone's homelessness by asking someone who provides services at the safe haven to write a letter of certification of their homelessness. Or if they're in an emergency shelter. So if they resided in an emergency shelter, their nightly stay, their log into HMIS, Help Management Information System, will account for their emergency shelter stays that they are currently homeless. And that last piece, that if they're living in a facility or an institution for less than 90 days and that they were homeless in one of those three places beforehand. The rationale is that if you were there for less than 90 days and you were homeless before, you are treating the symptom of homelessness. You are there and receiving time-limited, less than temporary services, but over 90 days, you're considered housed by HUD standards. Over 90 days, you are now using the system's resources, at least 1/4 and more of services that are that are now housing you, even though that might not have been the intention, but they are now housing you and are paying for your services. If you're in jail for over 90 days, you might be receiving medication, a mental health assessment, food, shelter, bed, maybe some other rehabilitation services. Now this facility has housed you, so you cannot count that time beyond 90 days as homelessness for someone. When we talk about documenting homelessness and what that looks like, that's one of the issues in accounting for it. But if you were there for less than 90 days, if let's say you were at a hospital, you had a procedure, and you were released in a 30 days, you were released in that time, that your time at that hospital was accounted for and can be counted as you being homeless if you were homeless on the streets, in a safe haven or an emergency shelter before entering that facility. This is the technical definition from HUD. And let's talk a little bit, now that we know of what's homelessness, what is chronic homelessness? So chronic homelessness is defined by an individual who has a disability, a verifiable disability. So it must be something verifiable. We'll talk a little bit what the verification looks like, and they must be living as described above, which means in a place not meant for human habitation, in a emergency shelter, in a place in a facility for less than 90 days, where you were homeless before, and that has to be, sorry about that, screen changes, that has to be the condition for you with your disability, and you've got to be in that place for at least a year, for 12 months. So those 12 months have got to be consecutive, or at least have 4 separate occasions in the last 3 years where the combined length of time of those occasions was at least 12 months. Which means you have to have 4 separate occasions of homelessness in the last 3 years that add up to a year, add up to 12 months. Each period must be separated by at least 7 nights where you're living in where you're housed. So that must be a period of where, let's say, you stayed with someone, you couch surfed, family member brought you in. So it must be 7 days or so. If it's less than 7 days, it does not count as an episode or a break in the episode, and you can count that time towards someone being homeless. So this gets to be a very technical definition, and you can imagine that your program coordinator will be working with you in really defining homelessness and chronic homelessness, if that is a program that you're in, that we really document not just the time that they were homeless, but document the breaks from hopelessness. Each period must also be documented, and we'll take a look at how do we document that? What does the verification of disability look like, and what does the chronic homelessness, or sorry, the homeless verification look like? And the definition for chronically homeless families as families where the adult of household has to meet this chronic homeless definition. Not everybody in the household, just the adult. And let's say the adult head of household. Let's say there's no adult head of household. Then let's say that everybody in the household is under the age of 18. Then that minor head of household, as they self-identify, has to meet the criteria of chronically homeless individual. And that family can be composed of anyone, right? So it could fluctuate based on who you're homeless with. So it doesn't have to be your biological family. It doesn't have to be your marital family. It doesn't have to be family that you're related to, but individuals that stay together are considered a family. Part of that system. So that's one great thing about the HUD definition. It does allow for the flexibility in some things, and at least staying in the stays of homelessness. And then where do we document homelessness, right? And one of the main systems where we document homelessness is on our help management information system, on our HMIS. We document it at different points at onboarding. Of course, if we're completing the HMIS enrollment form, if we're enrolling them into a program, that's where we're accounting for their homelessness. If you're filling out a VI SPDAT, the Vulnerability Index Service Prioritization Decision Assistance Tool, this is a tool that you conduct on someone if they're homeless, right? So it's not documenting their full homelessness, but it's generally asking questions that then we will dig into and verify their homelessness and take a look at what programs they really qualify for. And then there's the full SPDAT assessment that continues to measure hardships that someone's experienced as part of remaining homeless. And also we document it in our shelter nightly entry logs. In our shelter nightly logs, someone is checked into the shelter, reflecting that they used a shelter bed, and this can build a continual history of someone's homelessness, and we can access that on an ongoing basis. The forms, I want you to take a look at, we missed a slide here. I thought we did. How do we document homelessness, right? So not how, but why do we document homelessness? Number one is to facilitate the entry of someone into the coordinated assessment system, is to facilitate their road or the data so that it can lead someone to housing, can really lead to resources, a program that can assist them in ending their homelessness. And of course, it's in order for us to document our interactions, our services, our work with program participants and shelter guests so that we can really account for the work that we do and show that it is in relation in ending homelessness. So every interaction, every water bottle given, every food box, every nightly shelter stay, every move-in kit is documented in a way to reflect that we're helping end someone's homelessness or verify someone's homelessness. All right, so some of the forms that we take a look at, these are the three in particular when it comes to defining homelessness. First one is our HomeFirst documentation checklist of homeless verification form. So I'm going to bring that up here really quickly. It looks like this. It's a 2-page form, and we'll go through each one. And your program coordinator might want to review this with you also, which will be great because it'll be double reviewed and you'll get a really good punch about what defining homelessness and verifying homelessness really looks like. So here you're going to want to write the client's name, the date, and your information as a staff person if you're conducting the homeless verification. And as you can see, there's different categories, right? And each category, depending on what's best fit for them, you have to make sure that all of the participant, all of the following documentation is scheduled or added to your verification. So you can't just fill out this 2-page form and say, I verified someone's homelessness. You've got to attach some additional documentation, some appendices that really show how is it that you've checked this off. This is, again, the verification form. How do we then corroborate that information? How do we connect the dots and really reflecting someone's homelessness? And do not assume just because you're creating a file on someone and you filled out this form that you've done your best in documenting homelessness. If they have been staying at the BRC shelter or any other shelter in Santa Clara County, we have access to their nightly shelter stays as part of HMIS, and you're required to print that out and put it as behind this form in order to record their homelessness. So we'll look at the first category here, emergency shelter. If it's applicable, right, that they stayed in an emergency shelter, you would check here, and then you would check in file, right? So which means that this is not just applicable, but I've printed a copy of it, and this is a verification then of their homelessness. So there's 2 ways of showing emergency shelter stays. One is, of course, the written third-party documentation. You have to have one or more of the following: HMIS record of shelter stays, right? And for most programs, we want to take a look at the night before they enroll into a program. So we're interested in their nightly shelter stay record from the night before they enrolled into a program. So let's say today was January 1st, 2019. If that was the case, we want to take a look at their homelessness on December 31st, 2018. That would be the night before they entered into the program. So we want to take a look at their homelessness that night. This is for program verification, right? That's where you would use this form. Other than that, you would use a HomeFirst homelessness certification form. We're going to take a look at what the homeless certification form is and how to fill it out, and a signed letter on letterhead from an emergency shelter provider. Let's say they're out of county and you have a signed letter on letterhead from that shelter provider saying that they received services from this date to this day. We really want specific dates. So if you're asking for this letter, then you're asking for specific dates from someone, and that they're providing you with specific dates so that you can highlight and add to this person's record of homelessness. That's the third-party verification of emergency shelter verification. The other way of doing it is for the participant, the shelter guest, to write a self-declaration. In order to write a self-declaration, you need both of the following. You need a HomeFirst self-declaration of homelessness form, which is our form where they describe the state of their homelessness, and a written explanation by the staff of attempts to secure third-party verification. So it might be that you end up starting a self-declaration for someone, and then it shows that it turns out on that form, we'll take a look at it again together, that they stayed somewhere off of Bascom behind a In-N-Out. I don't know if there's an In-N-Out in Bascom, sorry. But let's say that there is, and let's say that that's where they stayed. And so what we would want to do is call business, especially that In-N-Out, and especially ask this person, was there anybody there whose name you know, who knew you, that could verify that you were homeless for that period of time? And that we would get that information. We would also get, if names are exchanged and this person knows them by name, we would want to get a release of information, call that In-N-Out, and ask for verification of their homelessness. At that point, you have a successful attempt at verifying third-party verification if the person confirms with you and says yes. If they confirm with you and said yes, then you have third-party verification, and you can, that letter, that signed letter on letterhead, or that verification on the phone call is enough. That could be part of the self-declaration, and you've received it. But let's say that attempt you've made the attempt, the person is no longer there, they cannot verify. You have to do as many attempts as possible, 3, if not more, attempts of possible of identifying someone's homeless verification in order to enroll them into a program. We work on that basis before we move forward. So you would start there, and then you would move beyond that. Next category, if applicable to them, would be a place not meant for human habitation, right? So shelter is one. The next one would be place not meant for human habitation. And on file, you would have to have a third-party verification of one or more of the following: HMIS record from a street outreach contact. So street outreach teams have a way of verifying homelessness through HMIS. So you can print out that HMIS record. Also, you could use the HomeFirst homelessness certification form. We're going to take a look at this form as well. So the homeless certification form could also serve as a report of them not meant for human habitation. And the third one is a signed letter on letterhead from a homeless street outreach provider or referral source that someone was homeless in a place not meant for human habitation. So those are the 3 ways that you can verify from a third party that someone was homeless not in a place meant for human habitation. The other option, of course, would be the self-declaration option. You'd have to have the HomeFirst self-declaration for homelessness and explanations by staff, written explanations on attempt to secure third party. So we would want to know names. We would want to know places you've called or gone down to if there's no phone numbers, and reached out to folks and said, using a description if you don't have a release of information that closely matches your client to obtain that consent. And they don't have to sign anything in order to verify. Them verbally telling you is a verification, and then you can fill out a certification reporting that you talked to so-and-so at this phone number at this location, and they verified to you that this person by this description sounds very familiar, and that they verified this person was homeless here. Right? And that would be then part of your written documentation. That would not be considered self-documentation if you're able to successfully complete that attempt. But again, if the attempt was there without successful verification, then it would be part of your written record. Again, the more the merrier. We need 3 or more in order for that attempt and for that self-declaration to be meaningful. And we don't want in programs, speaking strictly to programs, that we don't want self-declaration of homelessness to be the way that we prove someone's or verify someone's homelessness in each and every single file, because then it looks like we didn't work hard enough to secure the third-party documentation. This is always the preferred method, but we want to take a look at all the other options that are available as well. Next is the hospital or other institution form, that if a client stays for less than 90 days and or in emergency shelter or place not met home for human habitation before their admission, then we would need that. We would need a letter from that hospital stay and one of the following HMIS record that they were immediately homeless before that, a verification, a certification form, or a letter on letterhead. Transitional housing works the same way. If you're graduating from or timing out of transitional housing and were in emergency shelter stay not met for human habitation before that, we would count that as your time towards being homelessness. Domestic violence, this is where you have a HomeFirst, both a HomeFirst self-declaration and a brief written description or self-declaration by staff obtaining an oral statement. So this would be staff report obtaining an oral statement of kind of the events that took place. The person is not obliged to share the location, but another way to do this would be to obtain a letter on letterhead by the service provider who the household, received domestic violence assistance services from, and we would call that as documentation for domestic violence. This next category is for eminently losing nighttime residence. If someone is being evicted, they have less than 2 weeks, less than 14 days at their primary nighttime residence, and no other place identified, they have no other resources, money to support any other way, no one says that they can come in, and we would need to add a few of these things in order to prove that they are currently homeless. You would have to have that court-ordered eviction notice that shows that they are in a form that they were evicted or are currently evicted. And then if they're staying in a hotel or a motel, we need to make sure to document that lack of financial resources, that they cannot stay more than 14 days. So if they're staying night to night, we would need a bank statement that shows that they don't have, we need to show receipts, how long they've been in the motel for, even if they've been in their motel for more than 14 days, but they don't have enough funds to go another 14 days in that motel. And of course, you need an oral statement, a written statement by the head of household that this person will not allow them to stay there more than 14 days. And you would document that statement. You would document that statement on the written verification. So if you have written verification, let's say they're staying at a family, let's say they're crashing on someone's couch, they don't have the financial ability to sustain on their own. And at this time, they need help proving their homelessness, so that you could go to that person whose couch they're crashing on and ask them to write a letter saying that they're not welcome, and if their welcome ends in less than 14 days, then we would have a record of that, and that would go towards your proof of eminently losing nighttime residence. This is, again, you have to follow most of the steps, and you need at least one of the following, but I would make sure that if the person is staying in that motel, that all forms of income are noted, and that it's a recent statement from the month where they were homeless, which accounts for the finances and how they were utilized and how it will not go to support their current nighttime residence. So you have to do your due diligence and document your due diligence in attempting the statement and continuing to do so. This is a very tough one to provide, but some of our programs, like the Supportive Services for Veteran Families program, uses this verification of homelessness sometimes as often. The last one is persistent housing instability. This one is very hard to prove, and for the sake of time, I'm not going to go over it in great detail, but we do have a persistent homeless instability certification form. But this is a government form that we cannot have more than enough. It's hard to show persistent housing instability because most of the individuals we work with, housing is unstable for them. So this shows and documents a piece of housing instability for them, which most of our clients will not have a record of. So this is something that I don't think that at HomeFirst we utilize a lot of. If you have questions about how to qualify someone under persistent housing instability, please work with your program coordinator and appropriate director to get more information. But for purposes of this training, that's not one that I would highlight and recommend that you use. So this is the that form that we talked about really quickly, the homeless verification form. And next form I have here for you is the homeless verification form. So I'm going to bring that up really quickly. This is the HomeFirst homeless verification form, which asks the person to verify their current living situation. So it's either for them, the household without children, household with children, or just the person themselves. And you would then ask them to sign each box depending on what their current living situation was. This is a one-page form, and then we have the verification form that goes beyond that, the self-declaration form. But this verification form is where you would also participate in sort of documenting their homelessness. So if a person says that they're living in a place currently not meant for human habitation, and that that's where they were sleeping, we need a full description of the situation, the current park, who saw them, a homeless outreach program that will verify their homelessness at that time. We need that program's name, and we need that the authorized representative from that program, to their name and their signature to verify this person's homelessness. So by checking it, this is asking the street outreach person to verify someone's homelessness if we do not have a written record through HMIS or through any other means. Same goes for emergency shelter. If they were outside of the system, we could fax them this form, email this form, and have them fill out this area and send it back. We would want a full description. Again, if they're out of county, this sometimes is our best option. We would still want an attached letterhead describing how long they were there, the number of days, or when their stay began and when their stay ended, just for clarification and to help define this person's homelessness. Same goes for transitional housing, and same goes for the living situation of unaccompanied youth seeking runaway shelters and things of that sort. The next form I want to introduce is a client self-declaration of homelessness. The self-declaration of homelessness is a two-part form, and if third-party verification, again, this is considered third-party verification, the homeless certification, and HMIS stays, if this is not available, then you would fill out this form to self-certify their current homeless status. You'd write their name and where they currently are staying. And if they're currently homeless, then where is that, right? Where is a name and location of the places where they're not meant for human habitation? When you talk about cars, cars are also one of the places where someone is not meant to live. So if they're living in their car, we want to know where. We want to know make and model of the car, where was it parked, if they have any collaborating information, if they have tickets for parking from a ticketing officer, then that's something that we can add there as well. Same for emergency shelter. Emergency shelter, again, if it's on HMIS, it's better for you to print out the HMIS record because that's third-party verification. But if it was out of county, this might be your option until you can get verification from that service provider, and then you have third-party verification. Transitional housing, if they're being discharged from a hospital, we would need their hospital stay when they began staying at the hospital and when they were discharged from the hospital, and of course previous where were they homeless before that. If they're fleeing from a domestically violent situation, we would just ask them to check here. And again, if we're able to find a third-party verification, that's wonderful. A letterhead would be great, or even talking to a shelter provider and getting their verification, getting the staff supplement for verification filled out would be great. If they're being evicted from their housing where they're currently staying, right, and they must leave within the next 14 days, or 10 days or 5 days. They have no other housing identified. They have no other financial resources to support to obtain other housing. This goes along with the second portion here of the eminent losing nighttime residence piece. So this is the declaration form for that piece, and the applicant would then sign it and date it. So this is a piece that the applicant would fill out, and this is a piece the staff would fill out, filling out the supplemental information, your attempts to verify this information and certify that the individual or head of household is applying for assistance and that you've tried to attempt third party verification. Sometimes those attempts are successful. At that point, you would fill out this form and attach this verification. And if they are able to send you a letter on letterhead, then that is your third-party verification and you're good to go. If not, you would document all of your attempts here. Please add as additional pages as needed for you to fill out so you can support that form on an ongoing basis. All right. So that was a few things about just taking a look at verification forms. One other form that we didn't have in our checklist, which is the disability verification form, I want to bring out for you here. This is the HomeFirst disability verification we would need to do for chronic homelessness. And this has to be the part that's completed by the applicant, just their identifying information. The second part of it, the most important part of it, has to be completed by a physician or certified professional. And this form is not related to the SSI forms, but this is something for us to be used at HomeFirst for us to document disability. And this is part of how we document disability, to document chronic homelessness. So that's something for you to sort of think about in thinking about the forms of how you would define someone's homelessness and help document that homelessness as a part of finding avenues for them to end their homelessness. So again, if you have any questions, feel free to stop me, stop the moderator, stop the facilitator, and ask. Otherwise, I thank you for participating. Next steps would be to take a short quiz on defining homelessness so you can receive credit for this training. And again, I thank you so much for participating.